Good morning, Team NeoMed. It's an honor to be able to have the opportunity to provide you a weekly update on things that are taking place both on our campus as well as off to help you with your planning and understanding of the status of the university and how we are interacting with our local community partners and with the state at trying to temper the impact of the COVID-19 crisis and what it has done both to the university as well as the local community as a whole. I'm going to start with an item that has generated the most email and contacts and phone calls to the university with concern, and that is the uncertainty that's arisen around the return to work concept that's been proposed by the state. Now, we're hoping to get additional information from the governor in his presentation to the community today at 2 o'clock. But at this time, his plan is that we'll start a phased-in return to work protocol as of 1 May 2020, which is Friday of this week. My intent is that at NeoMed, we will not begin this process until May 4th, which is the following Monday. And part of the reason for that is I really want to make sure that we have good processes and procedures in place to ensure that we're doing this in a really thoughtful and intelligent manner that's going to ensure the safety of our team coming back to work. With that, we have finished out the survey sent to our faculty and to our staff. What we've learned from that was about 40% of all the NeoMed team members either have a condition that makes them at risk for COVID-19, or they live with somebody in their primary household who is an at-risk member. So we are working very carefully to ensure that we have a plan in place for you. We did not do this based on individual identification. It was purely to get the numbers so that we understood what impact this would have overall on our performance as a university. We can be very careful and judicious about the way we do return to work. As you can see that we've been able to continue to thrive as an organization and deliver on our primary mission of education and operating our organization to take care of our faculty and staff in a nearly seamless manner from the time we started this shelter-in-place protocol. There are other areas where we're just not able to be as impactful. And one of those key areas is, of course, in the area of mission research. So our research faculty members who've been so productive and successful in generating new knowledge, gaining funding through both federal, state, and philanthropic government organizations in order to conduct their work and progress the knowledge around healthcare and life science-based disciplines, has been pretty impacted by the fact that they are not able to be in their laboratories, that their staff and their team aren't able to continue to do their experimentation. So we are looking at safest ways to get those individuals back in place as a priority, understanding that education will continue on the way we've been doing it so well now, really thanks to the efforts of our IT team, our administrators, and our faculty and staff who are allowing us to continue to do this so well. So please stay tuned. We will have more information for you by the end of the week on how we're going to implement this initial phase of comeback in a way that's definitely looking out for the health, welfare, and safety of our staff and our faculty in doing so. My intent is that I will be back to work in place at the university during this period, during this week, and I will also be back in full force next week. I think it's important that your leadership team be here leading from the front so that you can see that we are here with you, although it will be a limited capacity of individuals who come back initially while we start to understand how we can safely phase this process into place. So more details will come. I want to thank Dr. Joe Zarconi, who has stepped up during this time of crisis to serve as our interim medical director for COVID-19. He has been appointed to sit on a statewide team of public universities led by Dr. Forrest Faison, who is the former Surgeon General of the Navy and currently at Cleveland State University. They've been tasked with the safe return to work procedures and policies that will be broadly adopted by the universities as a whole across the state, understanding that they'll be tailored specifically to each university's needs, but it will be a very thoughtful program that's going to give us guidance on how to do this and moving forward. The CARES dollars, which we've been working with the federal government to allocate to our students who've suffered significant financial deficits because of the COVID-19 crisis, is continuing to shape up. We've been working with the federal government and gaining a better understanding of what the intent of those dollars is. And it has been a little bit of a moving target as initial guidance we've been given has changed substantially. That said, we are expecting we should be able to draw down those dollars by at least the beginning of next week. And we've made amendments to how we can allocate those dollars to our students in need based on the new guidance that we've received from the federal government. My expectation is that unless there's something dramatic that changes with the governor's presentation today, that we will get information out on how to go about getting those dollars to our students by end of day today or at the latest by tomorrow. Those dollars are intended for those with financial need, and I believe one of the restrictions we're expecting is that you will either have to have already filed for or in the process before it can be allocated, file for FAFSA to show that you qualify as an in-need individual based on the federal programs. So that is underway. Our team has been working with that, and we will work hard to get this information out and the dollars out to our students in need so that we can continue to help you transition through this difficult time. That gets us to budget. I've had the opportunity to share every week for the last several weeks the concerns that we have on state budget allocation to the universities across the state, both for this fiscal year as well as the fiscal year starting in July 1st of 2020. What we've heard is that we should expect up to a 20% decrease in total dollars allocated, which would result in essentially a 6 to 7% total reduction in dollars to the university as a whole. We've learned a little bit more today. I understand Senator Ophoff, who's the president of our Senate in Ohio, indicated at the Akron Chamber meeting this morning that the state legislature is also going to be taking a very close look at budget dollars, not just the governor, but also the House and the Senate. And we should expect to see some type of impact that's going to be made public to us in the very near future. At this time, we are just preparing for ways to reduce overall expenditures at the university in a way that's smart, right? We need to be very careful about how we do this. My goal is for it not to impact employment of our critical team. You're here because we need you to take care of our faculty, our students, and our staff. This is an ecosystem where we work together and take care of each other. And the reason we have people employed is because you're critical to the accomplishment of our mission, which is education, research, and service to Northeast Ohio. So we will follow very closely. We are making plans in the meantime for ways to implement this carefully, while at the same time still ensuring that we have dollars set aside for smart growth. That is growth of programs that allow us to do our mission more effectively, more efficiently, but then bring in new opportunities to allow us to compete both locally and across the state to grow programs that are healthcare oriented so that we're delivering on our promise to take care of our local community by providing outstanding research, servicing the community, and creating the workforce of healthcare providers and researchers for Northeast Ohio. So we will be prepared. We're hoping that that preparation isn't required to take the full force of cuts that could be coming our way. But I think we, again, are in very good shape as a university, especially relative to the other universities in the state. And I want to make sure that you understand this because you're going to hear a lot more information about this coming from many of the other universities locally and across Ohio in short order. In fact, on Friday of last week, the University of Akron's president, Dr. Miller, came out with a communication to his team that they were expecting substantial changes to happen immediately. And some of those changes that he highlighted were some pay cuts that would be shared initially across the administrative team and more senior individuals within their organization, and his really challenging vision that they're going to have to do what they do by being smart about the programs that they maintain, about the programs they decide not to retain, and about their geographic footprint and the dollars that they're spending on the size geographically that they are of a university and maintaining the buildings that they currently have. It was a well-written email, and it was one that was really sharing this burning platform to do things differently in a way that was going to be more effective and efficient with the utilization of their dollars. I'm expecting we're going to hear that now from Cleveland State University, Kent State University, and others across the region as they start to understand the financial impact of COVID-19 and how that's really affected state support for our organization. Again, Neomed is probably in better shape than most, and I feel fairly comfortable that we're going to be able to do this in a way that's going to support our entire team. I do want to send a big thank you out to our healthcare members of our organization for everything you've done to take care of our community, our alumni, our clinical faculty at all of our sites. Really, you have done an amazing job taking care of the Northeast Ohio community, treating those who are ill, taking care of those in the intensive care units who've been critical, and working hard to ensure that we're able to share the information necessary to keep our faculty, our staff, our students, and our broader community safe from this terrible virus that has plagued our nation and plagued the world. You're true heroes, and we appreciate everything that you do for us. We have leaders that come out of Neomed on an annual basis and really going out and shaping the healthcare environment here and nationally. Was brought to my attention today some new names that I'd been familiar with. For instance, Dr. Malone, who's the president of Lutheran Hospital, one of the Cleveland Clinic hospital organizations, as well as Dr. James Kravick, who's done amazing work out with Mercy Bon Secours out in the Youngstown region. If you've watched the news, you'll see that they've really stepped up this ability to treat patients around serum utilization of patients who've already been infected and have become at least partially immune to the virus, and being able to get that type of innovative type of solution out to the healthcare environment to take care of patients. Really outstanding leaders across this country that Neomed has been able to produce. I also would ask that all of you consider reaching out to your networks, to your friends, to your families, to your colleagues, to consider continuing to support the Blue Fund. Mr. Daniel Blaine has worked hard with our foundation board to step up a special fund specifically to take care of our students during this critical time of need, ensuring that they have proper PPE for going back into the clinical setting where they're all going to need to get to again very soon in order to fulfill their educational requirements. Huntington Bank has very generously allowed us to use a $35,000 contribution from them to match additional funds coming in starting today into that Blue Fund group. So please consider those donations and reach out to your friends and your families and your colleagues also to look at supporting Neomed's work to take care of our students. Our students are stepping up as some of those critical heroes that I mentioned. I had the real honor of being able to teach a class here on Neomed campus, of course, virtually, on the pandemic, so that our students who are graduating now are able to understand how to deal with a pandemic surge in delivering healthcare understanding the SARS-CoV-2 virus in detail, and really understanding intensive care medicine around the treatment of these patients. And what I've learned is that many of our students in the local area have been asked to come to the healthcare arena early. Normally, they start their residencies, their internships around mid-June, but many of them have been asked and have volunteered now to come in and start serving the healthcare community as early as May 15th. They realize that this means they're putting themselves at increased risk with COVID-19 continuing to take place and patients showing up in those facilities, but they're doing so to honor their commitments to the profession, to take care of our community, to take care of patients. And my hat is off to them. What an amazing group of heroes. Our very, very youngest physicians and pharmacists stepping up to do amazing things now. Just absolutely incredible, and I couldn't be more proud of this group. Speaking of that particular group, this is a time of celebration. This is a time that I'm asking all of you to please come online. It's really much easier than it was before, having to drive in and figure out parking. Get on Zoom and attend the celebratory events for our students that are taking place across this entire week. Tonight, we will be honoring our student leaders through Student Leadership Awards. That will be a meeting that will be taking place by Zoom. I have the honor of being able to watch as students and student organizations get recognized for the incredible work they do. Tomorrow, Community and Family Department, Medicine Department, will also be providing Student Leadership Awards. And then on Friday, the College of Pharmacy will be having its Dean's Gathering for their graduates. And then on Saturday, we will be holding a virtual commencement. And our team, led by Sandra Emmerich and Rod Ingram, have really done an outstanding job putting together a truly impactful and professional program for us. And I think it's going to be an outstanding way for us to get on board and to actively share the wonderful celebration of graduation with our students. So please attend that if all possible. It's a great chance to watch them, see them with their families. Many of them will be getting hooded virtually by family members and loved ones. And I just can't think of a better way for us to celebrate with them together in this time where we can't come together physically as a community. And finally, I'd like to send a big thank you to the NeoMed Board of Trustees for their continued support, their guidance, and really giving of themselves to help us through these difficult times as we plan ways for the university to continue to move forward for a sustainable future. And with that, I'm going to pause and open it up to questions from the community.
The first question, because the virus is still circulating at high levels in the community, and there are concerns that despite some sanitation improvements at NBME test sites, that the students testing this summer may be at increased risk for illness. Also, will it be safe to have summer events on campus given the activity of the virus and risk of asymptomatic transmission?
Yeah, it's not clear what the safety around bringing community together on the campus in large groups would be over the summer. I know we had planned a homecoming weekend for the last week of July, but I understand that there's a strong likelihood that would have to be canceled. I've asked my team to continue to look at this and watch what's taking place across the state and across the nation, and by no later than June 1st, be able to give an answer to everybody in the community about how we'll approach this. It's an event we'd really like to be able to hold. However, we will not even begin to consider it if it looks like it would put anybody at risk, and we would simply cancel that and potentially put it off to another date. And it may have to wait until the following summer that we do this. This is something that's not being faced just by NeoMed, but by everybody across this region as they're struggling with how do we come together and celebrate the so many victories and great works of individuals and organizations that we traditionally did in person. And National Board of Medical Examiners testing, We've already got creative ways that we're approaching this. As far as those testings that have to be done nationally at secured sites, we are simply waiting on them to give us really feedback on how they're setting this up in a way that's going to ensure that the students are working in a virus-free and well-contained environment while they're not being exposed. So I don't have the information on that, and I don't think anybody does nationally. We're simply waiting on what they're doing for best practices right now.
What was the name of the task force concentrating on safe return for the university?
So the Inter-University Council has put together a group that's being led by Dr. Forrest Faison, who's currently a new member of the CSU team and the former Navy Surgeon General, who's got a great deal of experience dealing with these types of return to work contingencies during times of crisis. And he is leading an organization. I don't know that it has this particular name, but the task force has been asked to create a public university-wide return to work set of policies and procedures.
Since we may be faced with another wave of COVID-19 in the fall, do you anticipate permanent policy changes within HR to allow for more flexibility in working remotely, particularly for those whose job duties are all online and can be done remotely?
Yeah, we're working very carefully with HR right now to figure out what that would look like. I think our intent is to, when it's safe, our intent is to get folks back to the campus as much as possible. This virtual working has been actually working out for the university fairly well, but I think we need people to be back at least periodically. And I tell you that because I think overall, after 6 months, 7 months, a year, you start to lose touch with the organization, with the people that you are a team member with really understanding what it is we do until you put your feet on the ground and come in and see it taking place. So permanent policies are ones we're not going to be putting into place right now. I think we really need to better understand an after action study of how this has worked, where the strengths were, where the weaknesses were, what we need to overcome once this really temporary crisis measure has been removed, because everything can return to normal. It could be a great way for the university to operate more effectively, reducing our brick and mortar physical footprint and the costs associated with that, but we just need to be able to do it in a very careful manner. You bring up a good point, and that is being prepared for this potential resurgence that has been hypothesized by the director of the CDC for the fall and winter period. Even if we do get to the point where we're returning to work substantially over the course of the summer months, we will be ready to implement something immediately. We did it well last time, but we'll do it even more effectively this coming round because we are going to be prepared.
There are no further questions.
Please attend the celebration events if at all possible. And please know that I am dedicated to being completely transparent with you about the information as it becomes available and sharing with you our plan to move forward and to take care of all of those members of the NeoMed team. Thank you and be safe.